let's discuss the basic concept of yin and yang. The basic concept of yin and yang has the following key points. The concept of yin and yang and yang are the summarization of the attributes of two opposite aspects of correlative subjects or phenomena in the universe. From the perspective of relativity, the original meaning of yin and yang was very simple and was from the hieroglyphs. It mainly referred to the directions facing toward the sun and away from the sun. Facing toward the sun belongs to yang, while facing away from the sun belongs to yin. Based on the yin-yang theory, the ancient scholars made further inferences and extensions. Anything with the characteristics of facing toward the sun was classified as yang, while anything facing away from the sun was classified as yin. Generally speaking, the things that bear the properties of being active, external, ascending, warm, and bright pertain to yang, while the things that bear the properties of being static, internal, descending, cold, and dark pertain to yin. From the perspective of separability, the ancient scholars realized that all kinds of things and phenomena had two opposite sides. The mutual actions of the two opposite sides promote the formation, development, and change of things. Therefore, yin and yang was used to explain all kinds of natural things that were interopposite and mutually wane or wax. Interactions between yin and yang exist intrinsically within all kinds of things. Thus, yin and yang is refined to a specific philosophical concept. It is the summarization of the attributes of two opposite aspects of correlative things or phenomena in the universe. Now let's talk about correlation. Yin and yang refers to the attributes of two opposite aspects of correlative things or phenomena. It can be used to distinguish all kinds of phenomena under the condition that yin-yang stands for two correlative things or two opposite aspects within one thing. The ancients realized that all things can be divided without limitation. Any correlative things or phenomena in the universe can be summarized as yin or yang. Any aspect of yin or yang within one thing can be further classified into yin or yang. This classification is called the infinite divisibility of yin and yang. Everything is in constant motion. Therefore, the attributes of these things in yin and yang can change as well, which means that one side of yin and yang under a certain condition can transform itself into the other. That is, yin may change into yang and yang may change into yin. Obviously, the yin-yang attribute is in relative motion and changes constantly. So, the basic contents of yin and yang theory are mutual opposition and restriction, mutual rooting and dependence, waxing and waning, and balance, as well as mutual conversion. So to summarize again, the key points here are the basic contents of yin and yang theory, mutual opposition and restriction of yin and yang, mutual rooting and dependence of yin and yang, waxing and waning and balance of yin and yang, and mutual conversion of yin and yang. So let's first discuss mutual opposition and restriction of yin and yang. The opposition and restriction of yin and yang include two aspects. One aspect refers to yin and yang, while their properties are opposite in universe, such as heaven and earth, day and night, cold and heat, active and static, internal and external, ascending and descending, and entering and exiting. The other aspect refers to complicated relationship of mutual restriction and opposition between yin and yang, such as the four seasonal changes. It is warm and hot in spring and summer because ascending yang qi restricts the cold, cool qi, while it is cool and cold in autumn and winter because ascending yin qi restricts the warm, hot qi. These are results of mutual restriction between yang qi and yin qi in nature. Now let's go to mutual rooting and dependence of yin and yang. Yin and yang are rooted in each other. One cannot exist without the other. For example, upper belongs to yang and lower to yin, and without the lower, there would be no upper and vice versa. Left belongs to yang and right to yin, and without left, there would be no right and vice versa. Thus, it is obvious that yin and yang rely on each other. Interdependence of yin and yang refers to the mutual generation and promotion among certain categories of yin and yang relationships. Take, for example, heaven and earth and cloud and rain. The water and earth can be carried up to the heaven to form cloud and mist by the ascending of earthly chi, while the cloud and mist in the sky can fall onto the surface of the earth in the form of rain by the descending of heavenly chi. This reciprocal process of cloud and rain and heavenly chi and earthly chi is called the interdependence of yin and yang. Now let's go to the waxing, waning, and balance of yin and yang. The waxing and waning of yin and yang refers to the movement of yin and yang. The two opposite and interdependent forms are not in a state of stillness but constantly change. This change includes the following two types. The first type, yin wanes while yang waxes, or yang wanes while yin waxes. The mutual restriction of yin and yang leads to such a consequence. For example, considering the four seasonal change, from winter to spring and summer, the weather becomes warmer gradually, which is called yin wanes and yang waxes. While from summer to fall and winter, the weather becomes cooler gradually, which is called yang wanes and yin waxes. In the second type, yin wanes, the yang also wanes, or yin waxes, the yang also waxes. Under the conditions of reciprocity of yin and yang, any side of yin and yang becoming too deficient to promote its counterpart will make it weak, while any side of yin and yang becoming abundant will promote its counterpart. So yin-yang also gets abundant. For example, in qi and blood, qi belongs to yang and blood belongs to yin. Qi promotes blood production and its deficiency may further cause blood deficiency, resulting in manifestation of deficiency of both qi and blood. Tonifying qi can promote the generation of blood. Thus, qi and blood are both sufficient. The former is called waning of yin and yang, and the latter is called waxing of yin and yang. The waxing and waning movement of yin and yang is absolute and endless. When waxing and waning of yin and yang can be kept within a certain range, degree, and period, it will not be recognized and things will be in a relatively stable state. On the contrary, when waxing and waning of yin and yang are not kept within a certain range, degree, and period, things will be in an abnormal state. Now, let's go to mutual conversion of yin and yang. Mutual conversion of yin and yang refers to yin and yang conversion among themselves under certain circumstances. It is a change of the attribute of yin and yang. Anything has two aspects of yin and yang and is in the state of waxing and waning motion. When the motion is out of a certain range, one side of yin and yang can transform itself into the other. This change often occurs in the extreme phase during the changing cycle. The waxing and waning of yin and yang is a process of quantitative change, while the transformation of yin and yang is a process of the qualitative change based on the quantitative change. The transformation of yin and yang can be a gradual process, such as the alternation of cold and warm during the 4 seasons. It can also appear to be a sudden process, such as the sudden shock or fainting, as well as the cold extremities during the acute febrile disease symptoms. Symptoms change suddenly from yang to yin. No matter which kind of form it converses, it will always experience a process from quantitative change to qualitative change. Therefore, the mutual rooting and interdependence of yin and yang is the foundation for the transformation of yin and yang. And the waxing and waning of yin and yang is an important prerequisite for the transformation of yin and yang. Thank you for your attention.
Let's discuss interviewing the stool form and color. Changes in the form of stool. The normal form of the stool is soft and moist with a long oblong shape. So we have here the table for the stool form. If it is dry stool with dark yellow color, it indicates heat in the intestine. If it is small round stool like that of a goat, it indicates a liver chi stagnation. If the stool is small, round, very dry, it indicates blood deficiency. If it is loose and shapeless, this indicates deficiency cold in spleen and stomach. If there is initial stool, if it is hard followed by a loose stool, it indicates dampness from spleen deficiency. If the stool is randomly alternating loose and dry stool, it is liver spleen disharmony. If it is a loose stool with visible undigested bits of food, it could be a kidney or spleen yang deficiency. If it is a stool with yellow mucus, it is damp heat in the large intestine. If the form of the stool is yellow, sticky, with putrid odor, it indicates a food stagnation. If it is a stool with pus and blood, it indicates dysentery. Now, next is the changes in the color of stool. Normal stool color is brown, but stool color is often affected by food and drugs, which would not otherwise suggest a pathology. For the color of the stool, if it is dark yellow, this indicates heat stagnation in the intestine. If it is black stool like tar, this indicates blood stasis or far bleeding in the upper GI. If it is red blood in stool, this could indicate hemorrhoids or near bleeding in the lower GI. If it is red blood with white pus in stool, it indicates dysentery resulting from damp heat in the large intestine. If the color of the stool is grayish, white stool, this indicates damp heat jaundice, steatorrhea. Next is the abnormal sensation during defecation. Under normal circumstances, defecation should occur easily and smoothly without any uncomfortable sensation. If the patient have abnormal sensation like unsmooth defecation, which has abdominal pain with defecation, incomplete sensation, this indicates either liver attacking spleen or damp heat in the intestine. For the pathogenesis, there is a chi flow in the intestine. The chi flow in the intestine is obstructed, does not transport the turbid downward. Next, if there is a burning sensation, burning sensation in anus during and immediately following defecation. This indicates damp heat in the large intestine, which is excessive heat in the stool. If there is tenesmus, it's a paroxysmal abdominal pain, frequent and urgent desire to defecate, difficult to completely discharge stool, small quantities fecal matter, heavy sensation in anus. This indicates dysentery due to damp heat, which is damp heat obstructs chi flow in intestine. Next, if there is a fecal incontinence, patient cannot control defecation, stool is discharged spontaneously. This indicates spleen yang deficiency or kidney yang deficiency. For the pathogenesis, it is a spleen and kidney deficiency cannot control muscles, most likely appearing in elderly patients with chronic diarrhea or chronic illness. If there's a sagging feeling in anus, patient feels something sagging from the inner body to the anus. In severe cases, prolapse of rectum can occur. This indicates spleen chi deficiency. So pathogenesis is spleen chi deficiency compromises its lifting function. Thank you for your attention.
We discuss exogenous dampness for diagnosis according to pathogenic chi. Exogenous dampness can invade the exterior aspects of the body, that is, weight chi and the channels, and it can directly invade certain internal food organs. Dampness can be cold, neutral, or hot. Exogenous dampness can arise from invasion of climatic dampness or due to consuming a damp-producing diet. Contact with certain bacteria and viruses can result in damp cold and damp heat conditions. This could be anything from consuming spoiled food to cholera and salmonella. A pattern is defined by the symptoms and signs that are manifesting. If the symptoms and signs are those seen when there is dampness, whatever has caused the imbalance will then be defined as dampness and will be treated accordingly. For invasion of damp heat in Wei Qi level, fever is worst in the afternoon. There is aversion to cold, heaviness in the arms and legs, no thirst, sticky taste in the mouth, skin feels warm on palpation. There will be swollen glands in the neck, heavy and throbbing headache, head feels like a tight, wet towel has been wrapped around it, heaviness and obstructed sensation in the chest, sticky tongue coating. Then the pulse would be slippery, superficial, or soggy. For invasion of wind damp, the skin would be itchy and swollen. There is aversion to wind and cold, heaviness in the arms and legs, heavy and painful muscles and joints, little or no fever. Pulse would be superficial and slippery, tongue is wet. For invasion of dampness in the stomach, there will be bloating, nausea, vomiting, loss of appetite, heaviness in the body and head, fatigue, loose stools or diarrhea that is watery and odorless, sticky taste in the mouth, no thirst, greasy, white tongue coating, slippery pulse. All symptoms and signs will be acute. For invasion of dampness in the intestines, the diarrhea or loose stools would be watery and odorless. There will be borborygmi, heavy and black feeling in the abdominal cavity, bloating, nausea, vomiting, no thirst, thick white greasy coating on the tongue, slippery pulse. All symptoms and signs will be acute. For invasion of damp heat in intestines, diarrhea is explosive with sticky odorous stools, burning or stinging sensation in the rectum. Stool may be bloody, thirst with no desire to drink, odorous flatulence, dark urine, oily or sticky sweat, rapid and slippery pulse, sticky yellowish tongue coating. All symptoms and signs will be acute. For invasion of dampness in the urinary bladder, urine will be cloudy or oily. Urination will be difficult or obstructed. Frequent but scanty urination, heaviness, tightness, or obstructed sensation above the pubic bone. White oily coating on the root of the tongue. Pulse is slippery or tight in the left shear position. All symptoms and signs will be acute. For invasion of damp heat in the urinary bladder, Urine will be dark, cloudy, and odorous. There may be blood in the urine. Frequent, scanty, and burning urination, yellowish and oily coating at the root of the tongue, rapid and slippery pulse, especially in the left shear position. All symptoms and signs will be acute. For invasion of damp heat in the gallbladder, there is acute pain under the ribs, sensation of heaviness, nausea, sticky, bitter taste in the mouth, yellowish thick coating on one side of the tongue, rapid, slippery, or tight pulse, especially in the left quan position. For invasion of damp cold in the uterus, vaginal discharge should be thin and watery and whitish. Vaginal discharge is odorless or smells like fish. Sticky white coating on the root of the tongue. Slippery pulse, especially in the shear positions. All symptoms and signs will be acute. For invasion of damp heat in the uterus, yellowish sticky discharge from the vagina that is odorous and smells like leather. There may be vaginal itching and the mucous membranes may be red. Sticky yellowish coating on the root of the tongue. Rapid slippery pulse, especially in the shear positions. All symptoms and signs will be acute. For invasion of dampness in the channels or joints, this is B syndrome, where dampness is the predominant pathogen. The pain will be heavy and dull, and there will often be numbness. There will usually be swelling around the joint, possibly with puffiness or edema. Pain is not sharp and will usually have arisen gradually. Symptoms will be affected by humid climates and locations. There will generally be fatigue and heaviness. The tongue can be wet with a thick, sticky coating. Pulse can be slippery or soggy. All symptoms and signs will be acute. For invasion of damp heat in the joints, often several joints at once will be affected. Joints will be sore, painful, swollen, and red, and they will feel hot when palpated. The person will often have additional characteristic heat signs, such as a red face, thirst, rapid pulse, and red tongue. All symptoms and signs will be acute. Thank you for your attention.
Let's continue with diagnosis according to 6 stages. This time we'll talk about invasion of wind cold in Taiyang aspect, where wind is dominant. Invasion of wind cold in the Taiyang aspect, where wind is dominant. There is a Wei Qi deficiency. This means that pathogenic qi does not need to be so potent to be able to invade the body, and the symptoms and signs will not be as pronounced as in the previous Taiyang excess pattern. Because the person is Wei Qi deficient, they will often have a strong aversion to sitting in a draft and being exposed to the wind. A key symptom that can differentiate this from the previous pattern, which is invasion of wind cold in the Taiyang aspect where cold is dominant, is that in this pattern, the person will sweat spontaneously, but the sweating will not relieve the condition. The person sweats spontaneously because the deficient Wei Qi is not able to control the pores and is not strong enough to expel the pathogenic qi. The pulse will be weaker in this pattern and it will not be tight because the deficiency of qi means that there is less stagnation. The mechanism behind the other symptoms and signs are the same as in the previous pattern. This pattern has its etiology in exposure to wind and cold, and it has the following symptoms and signs: acute headache, stiffness in the neck, shoulders, and upper back, aversion to cold and especially wind and drafts, spontaneous sweating but without it relieving the symptoms, sneezing and coughing, runny nose and watery eyes, facial edema or puffiness around the eyes, possible low-grade fever, aching in the muscles and joints, thin, white, and wet tongue coating, and a superficial and slow pulse. The key symptoms here are aversion to wind, spontaneous sweating, and a superficial pulse. For the treatment principle, we expel wind cold, activate the Wei Qi, and tonify the Wei Qi. So for the acupuncture points, we can choose from SI3, UB10, UB12, UB62, LI4, lung 7, lung 9, stomach 36, spleen 6, REN 12, DO14, and GB20. We may use the 25 needling technique on lung 9, stomach 36, spleen 6, and REN 12, and draining technique on the rest of the points. Moxa is also recommended. So to further explain the choice of points, stomach 36, spleen 6, REN 12, and lung 9 tonify post-heaven chi and thereby the Wei chi. SA3 and UB62 open the Taiyang channel, activate the Wei chi, and expel wind cold. UB10 and GB20 expel wind cold. LI4 and lung 7 and UB12 activate Wei chi, expel wind cold, and regulate lung chi. DO14 activates the Wei chi. When a person has been invaded by wind cold in the Taiyang channels, they should avoid eating rich food and should preferably only eat soup. They will benefit from drinking hot, spicy drinks such as whiskey toddy, hot ginger tea, or an infusion of garlic, cayenne pepper, ginger, and honey. They should then wrap themselves up in blankets or quilts to induce a sweat. They should avoid exposure to drafts, and they should make sure that they are suitably clothed when they are outdoors. They should preferably rest and stay indoors until they are healthy again. An invasion of wind cold in the Taiyang aspect, where wind is dominant, can be caused by qi deficiency, and in turn can result to Taiyang Fu pattern, Yangming stage pattern, Xiaoyang stage pattern, Taiyin stage pattern, and Shaoyin stage pattern. Here is a comparative table on the symptoms of Taiyang cold syndrome versus Taiyang wind syndrome. In Taiyang cold syndrome, there is no sweating, while in Taiyang wind syndrome, sweating does not alleviate the symptoms. There is extreme aversion to cold in the cold syndrome, while less aversion to cold and extreme aversion to wind and drafts in Taiyang wind syndrome. There is severe headache and stiff neck in Taiyang cold syndrome, but a milder headache and stiff neck in a Taiyang wind syndrome. And there is a tight pulse in Taiyang cold syndrome, and the pulse is not tight in the Taiyang wind syndrome. Thank you for your attention.
Let's discuss treatment principles in the case history number 4. This is a case of a woman aged 24. The clinical manifestation, this patient had an exterior condition overlapping a chronic interior one and only came for treatment after the exterior condition had set in and penetrated to the interior. As this is a complicated case, the clinical manifestation is divided into 3 groups: the underlying chronic condition, the acute, and the exterior attack, and the sequelae of such an attack when she came for treatment. First, for the chronic condition, propensity to catching colds, giddiness, deep fine pulse, both rear positions very weak. For the tongue, it is pale, purple, dry. Number 2 is acute exterior attack. The temperature is 101 degrees Fahrenheit. Feeling of heaviness, body aches, headache, buzzing in the ears, giddiness. Number 3, the sequelae, constant temperature of 99.5 degrees Fahrenheit, lack of balance and coordination, tinnitus, nystagmus, extreme tiredness, poor sleep, lethargy, feeling of heaviness of the legs, numbness of the limbs, hospital headache. In particular, the lack of balance and coordination was very pronounced and led Western doctors to suspect a neurological lesion. For the diagnosis and explanation, the chronic condition, severe kidney yang deficiency. In this case, the tongue is dry from deficient yang qi, unable to transport fluid to it. It is also purple as the deficiency of kidney yang has caused interior cold, which in turn causes stasis of blood. For the number 2, the acute exterior attack, this was an attack of the exterior wind damp heat. For the sequelae, these are caused by the exterior pathogenic factors penetrating in the interior. The heat and dampness have become interior and caused the constant low-grade temperature. Once in the interior, they disturb the circulation of qi and blood and overlapping with the pre-existing condition of kidney yang deficiency. They cause the rising of liver wind, resulting with the symptoms of nystagmus, lack of balance and coordination. These are caused by interior wind arising from the deficiency of blood and kidney yang. In addition, damp heat is steaming in the interior, causing the constant low-grade temperature, numbness, extreme tiredness, feeling of heaviness, and lethargy. For the treatment principle, the patient only came at the sequelae stage. When the condition was an interior one, it has characterized by an extreme deficiency of upright qi and by the presence of formerly exterior pathogenic factors now become interior, which is damp heat. In addition, the exterior attack had also given rise to another interior pathogenic factor, that is liver wind. This is one example of a situation when the manifestation becomes primary. The root is represented by the chronic condition of kidney yang deficiency, which must eventually be treated as it also predisposes to liver wind. However, the manifestation in this case assumes primary importance as it causes symptoms which require urgent treatment. The manifestation in this case is represented partly by damp heat and partly by liver wind. Both, this particularly the liver wind, need to be treated without delay. Treatment in this case was aimed at treating the manifestation first and expelling the pathogenic factors first and later tonifying the upright qi. The treatment was aimed at clearing interior heat, resolving dampness, extinguishing wind, and pacifying the liver. Various groups of points were used at different times to achieve these aims. LI11 and DUP14 were used to clear interior heat. Points on the governing vessel are particularly important to clear latent interior heat resulting from invasion of previously exterior heat. Points such as spleen 9, spleen 6, ren 9, bladder 22 were used to resolve dampness. Liver 3, GB20, DU16 were used to subdue liver wind. Only after the symptoms of damp heat and liver wind had gone was the treatment aimed at tonifying kidney yang by tonifying and warming bladder 23, ren 4, and kidney 7. Thank you for your attention.
For diagnosis, according to Zhang for organ patterns, we take up damp cold in the large intestine. This is again a purely excess pattern of imbalance, but there may well be an underlying yang deficiency condition, which means that the body has difficulty protecting itself from exogenous cold or transforming cold foods that have been ingested. The large intestine can be directly invaded by exogenous pathogenic qi through the skin if the person has had cold, wet clothes on the abdomen after they have been swimming or has sat on the cold, wet earth. Damp cold can also result from consuming cold or cooling food and beverages, both thermally or energetically cold. Symptoms and signs are diarrhea, stools are watery and explosive, borborygmi, cramping pain in the abdomen, the skin of the abdomen feels cold when palpated, the abdomen can feel tense or distended when palpated, aversion to cold, thick white and wet tongue coating, slow and possibly tight pulse. Key symptoms are watery diarrhea, cramping pain in the intestines. Treatment principle, drain damp and cold from the large intestine. Then we choose from stomach 25, stomach 36, stomach 37, ren 8, spleen 4, spleen 9, and bladder 25. Needle technique is draining, except for REN 8, which should be treated with moxa. Moxa or a moxa box on the abdomen is recommended. Stomach 25, stomach 36, stomach 37, spleen 4, spleen 9, and bladder 25 drain the damp cold from the large intestine. REN 8 with moxa expels dampness and cold from the large intestine. When there is damp cold in the large intestine, the person should avoid consuming food and beverages that are cold or have a cooling energy. They will benefit from drinking ginger tea or other spices that are warming and spreading in their dynamic. It is important to keep the abdomen warm and dry. Damp cold in the large intestine can be caused by spleen yang deficiency. Damp cold in the large intestine can result in yang deficiency. So to summarize, etiology would be invasion of exterior cold with possible underlying stomach qi or yang deficiency. Signs and symptoms: constipation accompanied by sudden abdominal pain, feeling of cold, diarrhea with pain, cold sensation of the abdomen, bland taste in the mouth. Pulse would be wiry and deep, especially on the right rear position. Tongue is white with scant, thick white coating. Scant, sticky white coating. Treatment principle: warm the yang and free the stool. Rectify qi and relieve pain. Acupuncture treatment: stomach 25 will stop the diarrhea, regulate intestines. Stomach 35 will stop the diarrhea. Spleen 6 resolves damp in the lower burner. REN 12 resolves dampness. Sanjiao 6 frees the bowel qi. REN 6 warms the lower burner. Bladder 25 supplements the large intestine qi. Stomach 27 regulates qi and promotes urination. Spleen 9 for damp in lower burner. Bladder 22 regulates water passages. REN 4 dispels cold. REN 8 moves gastrointestinal qi, transforms cold stagnation. We needle with supplementation or tonification or even method with large amounts of moxa. Thank you for listening.
Let's now discuss yin deficiency as we continue with diagnosis according to 8 principles. Yin, like blood, is nourishing and moistening and anchors shen. This means that there is a similarity in some of the manifestations of yin deficiency and blood deficiency. Dryness, for example, is a manifestation of both yin deficiency and blood deficiency. Where there is yin deficiency, the dryness will be apparent in the mucous membranes of the orifices, especially in the vagina, lips, mouth, nose, and throat. The dryness often manifests as a slight thirst, but the thirst will not be as intense as it is when there is excess heat. There will be a need to sip a glass of water, especially during the evening and at night, rather than drink a large glass in one go. Yin controls yang. If there is yin deficiency, the uncontrolled ascendant yang can cause night sweats and the person to feel hot at night. If the shen is not anchored by yin, there can be insomnia. When yang heat is not controlled by yin, it will ascend to the head and visibly manifest as red cheekbones. Dizziness can arise because there is not enough yin to nourish the brain, and because if there is too little yin, it can fail to anchor yang, which then ascends in an uncontrolled way up to the head, causing dizziness. The lack of moisture in the body that is characteristic of yin deficiency can also mean that the stools are very dry and there is constipation. Because yin is substantial, a person who is yin deficient will typically have a thin, slender body. The tongue will also be thin. There can be a lack of coating on the tongue, as well as cracks in the surface of the tongue. If yin deficiency has resulted in empty or deficient heat, the tongue will also be red due to heat. The pulse will be fine or empty. If there is empty heat, the pulse will be rapid. The person's movement can be restless and fidgety, especially if there is deficient or empty heat. This is because the rootless heat and yang will agitate qi in the muscles. As was the case with qi deficiency, yin deficiency can be a generalized condition and it can be more specifically related to certain organs. The organs typically are yin deficient are the kidneys, liver, lung, heart, and stomach. Again, it will be possible to observe signs that indicate that there is a disturbance of their functioning. Yin deficiency has its etiology in prolonged illness, stress, overexertion, working at night, coffee, narcotics, some forms of medicine such as steroid, a diet that is heating or simulating, congenital weakness, and old age can all weaken yin. Prolonged fire imbalances and chronic blood deficiency will also injure yin. The symptoms and signs of yin deficiency are the following: insomnia, dry mucous membranes, dry skin, dry mouth and throat, constipation or dry stools, night sweats, feeling warm in the evening and at night, malar flush, thin body, restless movements, dizziness. The tongue can be thin, dry, and lacking coating, possibly with cracks in the surface. If there is deficient heat, the tongue will be red. There is a fine or empty pulse, and if there is deficient heat, the pulse can be rapid. The key symptoms here are dry mucous membranes, insomnia, malar flash, fine or empty pulse. For the treatment principle, we nourish yin. In our acupuncture treatment, we can choose from kidney 3, kidney 6, ren 4, UB23, UB52, spleen 6, and lung 7. And we use the tonifying needle technique and no moxa. UB23, UB52, ren 4, kidney 3, and spleen 6 nourish kidney yin. Lung 7 and kidney 6 in combination open ren mai and the yin chao mai and thereby nourish kidney yin. So it is crucial that the person who is yin deficient gets enough rest and relaxation. This means that they must get ample sleep and go to bed early at night. They must not work too hard or spend too much time in front of the computer, using a smartphone or watching television, as this stimulates the mind and thereby consuming yin. A person who is yin deficient should also avoid stimulants such as coffee, which will stress their system. Alcohol is not good for them because it is both spreading and heating in its dynamic. They should generally try to avoid food and beverages that are stimulating and heating, especially hot spices such as chili and garlic. The way that food is prepared will affect its temperature. Raw food is the coldest, then steamed, boiled, sauteed, fried, baked, grilled, roasted, and deep fried, which is the most warming. If there is yin deficient heat, the person should avoid more heating cooking methods. Baked food can also be drying, which is not good for yin deficiency. Soups and stews will be the best preparation method as these are not drying. Concentrated proteins, green leaf vegetables, cereals, and root vegetables will help replenish yin. Foodstuffs that are rich in oil and minerals, for example, nuts and seeds, will also nourish yin. Sweating is to be avoided because it will make the person lose body fluids. This means that they should not use saunas, Turkish baths, or practice hot yoga. Ordinary yoga, qigong, and tai chi are, on the other hand, beneficial forms of activity that nourish yin while circulating qi. Dynamic activities such as aerobic or action sports will not be good and should be discouraged because they will further strain a person's yin. Shiatsu, massage, and meditation are also good because they bolster peace and tranquility in the body and thereby replenish yin. Men should avoid having too much sex, including masturbation, because there they lose qing and thereby kidney yin when they ejaculate. Thank you for your attention.
Let's discuss depression by heart-yang deficiency. The clinical manifestation, there is depression, feeling cold with desire to curl up, not wanting to do anything. There's palpitation, tiredness, easily startled. The tongue is pale and the pulse weak or knotted. For the pathology and mental emotional pattern, the heart houses the mind, and a deficiency of yang of the heart affects the mind, causing depression. As there is yang deficiency, there is in particular a lack of activity and of drive, so that the patient does not wish to do anything and finds everything a struggle. Note that as there is yang rather than blood deficiency of the heart, there is no anxiety or insomnia, but a propensity to be startled. The patient's profile, the pattern of heart-yang deficiency is more common in middle-aged or elderly patients. For the treatment principle, we have to warm and tonify the heart, calm the mind, lift the mood. Heart-yang deficiency points, we use heart 5, do 14, bladder 15, ren 6, stomach 36, spleen 6, do 20. All points with reinforcing method, moxa should be used. Heart 5, do 14 with moxa cones, and bladder 15, tonify heart chi and heart yang. Ren 6, tonify chi and yang in general. Stomach 36 and spleen 6, tonify spleen chi, do 20, lips mood. Thank you for your attention.